extremely thanks to Apollo team. Apollo team has given me very much support. When I came, I was not in that good condition, but I can realize. But each and every doctor has given a very good support, and particularly in IC, they taken care like anything. I want to say personal thanks to Karunakar and Niranjan team and everybody's. Their support was really good, but I cannot say what is the treatment has taken, how they taken, but the hospitality way they given, the support has given, including us, everybody is given very good hospitality, very good support, moral support. When I how discharge also, they are giving very good support. I am extremely happy, thanks to Apollo team.
This gentleman had a massive heart attack in the flight from Chennai to Hyderabad. When he landed, he had very low blood pressure. With that blood pressure, our Apollo Medical Center airport, they started him on blood pressure increasing medicines. With that support, they have shifted him to the emergency room. When I saw him in an emergency room, he was having very severe breathing difficulty. So we have intubated him. We have put him on ventilator support. With the ventilator support, we have taken him for the primary angioplasty procedure. That is a stenting procedure, angiogram and followed by stenting procedure. So during the procedure, we found that his blood pressure still was low. So initially we stabilized him. We tried to stabilize him with intra-aortic balloon pump IABP support. But even with IABP support, his pressure was not maintaining. So we could clear one blockage. The main channel was totally occluded along with two other critical blockages. So first we addressed the main channel blockage. We put a stent there, but even after putting the stent, his BP was not recovering. So at that stage, we decided to go ahead with Impella device. Impella is a world's smallest heart pump. So it acts similar to the heart. It pumps the blood from into the circulation as if the heart is pumping blood into the from its chambers to the circulation. So it mimics the heart pumping function, and it maintains the vital organs perfusion like brain and kidneys, and it supports during the interventions. So we have done that procedure successfully because in Apollo we have advanced critical care center with round the clock shock team, available shock team with advanced mechanical circulatory support systems like IABP, Impella, ECMO. So because of the availability and because of the advanced training which we had here, so we could do that procedure on time. But the unfortunate event, he had a cardiac arrest during the procedure, but still we could able to bring him back because of the Impella support. So without Impella, probably he wouldn't have made it. So anybody in this situation who needs advanced medical care, the center like Apollo will help them. And we have a critical care team, and we have a mechanical circulatory team available round the clock. And I'm thankful to the family and their encouragement. Actually, these type of supports, we need a lot of counseling, we need a lot of their support. Without their support, we wouldn't have done that. Thanks to the family and thanks to our management for constantly encouraging us to give best care to our patients. Thank you.
My father, he works in L&T as a senior architect. He experienced a cardiac arrest while coming to Hyderabad during the flight itself, while the flight was landing. So while the flight was about to land, he experienced the cardiac arrest. So immediately he was shifted to the Apollo first aid facility that was present at the airport, and then there they gave the first aid treatment to him. And then from there he was shifted to Apollo Jubilee Hills, and Dr. Karunakar sir took him and gave him the necessary treatment. So he had 3 blockages. So the doctors were very prompt and very cautious. So they immediately, thought of a new advanced technology, which is heart Impella, and with the support of this particular device, my father was revived back and they were able to stabilize him. So for first 2 days he was quite in a critical situation, and then with the impeller support he was able to further stabilize himself. And then Dr. Karunakar sir and his entire team was constantly monitoring him and constantly taking proper care of him, which was very vital for his particular condition. And then during the first course of the week, they did the second angioplasty for him, which removed the second blockage that was present in my father's heart. And then, so this was done with the impeller being there in his heart. So the impeller was an aided support for that procedure. So once he was stabilized after the second angioplasty, the impeller was removed, and then my father was able to maintain his own blood pressure during the course of time. This treatment was like, we are from Chennai basically, and this treatment is, I think it doesn't it isn't authorized or patented in Chennai Apollo itself. I think that's the case. So luckily he was here, and the doctors were they were prompt and they were cautious and gave him the necessary treatment, which made him walk and be normal, somewhat to normal.
It's there in Chennai Apollo, but not in majority of the centers across the India.
So then after that he had some secondary issues, which were also properly taken care by the Apollo staffs and other ICU in charges as well. And then he was discharged with he was perfectly stabilized. His condition from day one and his condition on the day of discharge was drastically improved. He was able to walk on his own. He was able to eat on his own. He was he was gaining his normal self, and it was very it was a very big journey for us as well. But I think the Apollo staffs and especially Dr. Karunakar sir was a major support in this unfortunate journey. But without Karunakar sir's moral support as well as medical support, it wouldn't have been possible.